Hey everyone, I wanted to talk to you guys about knee pain and some of the common causes and conditions that we see in our office. Because it is we do see this pretty often. It's not just the the neck and the back pain people often associate with chiropractors. Um, so the first thing that we do when somebody comes in with a knee complaint is we want to test and we want to rule out any structural damage to the knee. So this would be things like ligamentous damage like an ACL or an MCL, or any cartilage damage like the meniscus. And we do this because we want to make sure that the patient is in the right place to receive care. So if we feel like something's not right, or there's more going on, we want to make sure we get them to the right person, the right place, and maybe even seek further imaging. So if all of that testing and evaluation checks out, everything is stable, it's structurally sound, we're going to continue on with our evaluation and our exam, because we want to figure out what is causing the pain in the knee. So I wanted to talk to you guys about the three most common conditions that we see and give you a little bit of insight on what they are and why they may be causing the pain. So the first one, by far the most common one that we see, is called patellofemoral pain syndrome. So your patella, your kneecap, and your femur, your thigh. So with this one, typically it's dull pain around the knee, not necessarily pinpoint, but it's kind of always there. And usually it's aggravated when loading the joint. So running, squatting, jumping, and then especially walking downhill or walking down. That is very common to see with this. So as far as patellofemoral goes, there is a natural tracking that occurs, right? So every time we bend, flex, and extend, tracking that patella, the kneecap is moving back and forth in these little grooves through here. And if that gets thrown off, you're going to start to have some irritation. So what happens with this syndrome here is the outside part of the femur here starts to kind of inwards, it starts to kind of crash into or hit that patella. So it's literally like the knee is diving towards the middle there. And this, over time, if this happens over and over, it's going to start to become irritating. You're going to start to get that pain there. There's a couple things for why this can happen. Number one is weakness at the hips. So we need good stability at the hips to prevent the femur from diving in towards the middle there. And if we're lacking that, it's gonna start to hit on the patella there. The other reason for this is overpronation of the feet. So when we hit the ground and we're going through our motion here, so when we hit the ground there, just like that, there should be some natural give in the foot that kind of rolls down towards the ground. But if there's too much of that, so that's the hyperpronation part, if there's too much of that, the shin actually is going to, so the tibia, the shin, is going to it's going to start to rotate in, and that femur follows with it. It's rotating in. So we're getting that, the sliding of the femur into the outside of that patella. So kind of want to look at all things here, not just the knee. Look at the hips, look at the feet as well. So the second one that we often see is IT band syndrome. Everybody knows where that IT band syndrome is, or where that IT band is. Talked about all day, every day. And this is more of a kind of a sharp burning pain, more on the outside of the knee, in that lower part. I mean, right on the outside there, and very common with runners and activities that require a lot of bending of the knee back and forth. So like cycling, weightlifters doing a lot of squatting stuff, and I feel like there's kind of a misconception or a notion out there that this is caused by snapping of the band back and forth. So I just want to clear that up here. It's been shown that the pain with this is not due to snapping of that band back and forth, which would create inflammation of a bursa down here underneath the IT band, and then inflammation of the IT band as well. So 2 reasons on why that's not the cause of this is, number one, there's not a bursa down here underneath the band. And number 2, there hasn't been any solid evidence to show that the IT band itself truly gets inflamed. So just to kind of clear that up there, what it is caused by is repetitive compression of the band on very sensitive fatty tissue underneath the band, with a lot of pain receptors. And also there's a thought out there with recent research that there's excessive pulling or tensile strain where the TFL, so the TFL in the glute comes down and it meets the IT band, and that goes down the rest of the way. So where these 3 things meet, these 2 muscles up here and then the IT band, where they meet, they've seen that there's pulling on the bone, the femur itself, which can cause some of that irritation and or not necessarily inflammation, but irritation and pain, but not from tightness in the band itself. Now, the compression of the band can be due to, kind of going back to that first one, is excessive rotation of that knee inwards, and then that hip and that femur diving in towards the middle. So both of these things together causes that repetitive compression on the outside, near the outside of the knee. And then the other thing is tightness through the TFL can cause, again, like what we just talked about, that pulling on the bone through there. So with this one, the hips are a little bit unique. You want to have good mobility through the hips to prevent pain in other places, but you also want to have that good stability through there, especially with running, to prevent those types of things going through there. So, right, good mobility through there, flexibility for, to prevent kind of some of that TFL tightness, but then also the stability through there, so we're not getting that compression all on the side of that leg over and over and over. The third one is called pezanserine bursitis, and this is pain more on the inside of the knee. So this is going to be kind of where you have that big bony bump there. A little bit more towards the inside there is typically where you'll start to feel that. And so where this spot is here, there's 3 muscles that all kind of come together down the leg, and the tendons of them all come together and they insert onto the inside of the tibia of the shin. And then underneath of it is a bursa called the pezanserine bursa, which helps to lessen the friction between the tendons and the bone there. So it's like a thin, lubricated cushion. And this can also, going back to kind of the other ones here, be caused by a lot of that internal rotation of the knee, that femur and that knee diving in towards the middle. And so with that, when that happens, what can happen is it irritates that bursa and it becomes inflamed and it starts to produce more fluid. So you have a lot of kind of inflammation through there. Typically, this is pretty self-limiting, but it can also be caused by hamstring tightness. And then again, that rotation of the knee, diving of the hip inward, hip weakness. So kind of a common theme there with the hips here. They need to be checked if we're dealing with something like knee pain. So really with everything that we see, we try to give, a structural and then a functional diagnosis. So structurally, what's involved, what's irritated, and then functionally, it's why is this causing pain? That's what we want to really figure out. Not so much just kind of chase the area of pain, but figure out the reason why it's happening. And with the knee, a lot of times it is something above the joint, something above it, above the knee, or something below the knee. So I hope this was helpful. Let me know if you have any questions. Don't forget to subscribe to our channel. And we're going to talk more next week about hip function in relation to the knee.